The silent risk most people never see coming. Imagine waking up on what feels like an ordinary Tuesday morning. You shuffle into the kitchen, start the coffee maker, and reach for the same pill organizer you've been using for years. Monday, Tuesday, Wednesday, every compartment is neatly filled. A pill for blood pressure, one for arthritis, something for heartburn, maybe another to help you sleep through the night. It's a routine you've followed so many times that you no longer think about it. After all, these medications were prescribed by doctors or purchased from trusted pharmacies. They've become part of your daily life, almost as automatic as brushing your teeth. But what if one of those familiar pills deserved a second look? Not because it's a bad medication, not because your doctor made a mistake, but because your body has changed. As we grow older, our kidneys don't always filter medications as efficiently. The liver may process drugs more slowly. Blood vessels become less flexible. The heart works differently than it did decades ago. A medication that was appropriate at age 45 may need to be reviewed at age 65 or 75. Many people never realize that. They continue taking the same medications for years, sometimes decades, without asking one simple question: is this still the best choice for me today? That question could be one of the most important conversations you ever have with your healthcare provider. Let's meet Robert. Robert is 68 years old. He enjoys fishing on weekends, spoils his grandchildren whenever they visit, and rarely misses his morning walk around the neighborhood. He considers himself reasonably healthy. Like many people his age, he also takes several medications every day. One helps with knee pain, another controls acid reflux, a third helps him sleep. He never questioned them. Why would he? They seem to be working. Then one afternoon during a routine checkup, his physician looked over his medication list and paused. Not because Robert was taking anything unusual, quite the opposite. Every medication on the list was common. Millions of people take them every day. The doctor's concern wasn't what Robert was taking. It was how long he had been taking them, and whether his current health still matched the treatment plan that had been created years earlier. That appointment didn't end with panic. It ended with a conversation. Some medications stayed exactly the same. One dose was adjusted, another medication was no longer necessary, and one over-the-counter medicine Robert used for sinus congestion turned out to be something his doctor wanted him to avoid because of his blood pressure. Robert left with fewer questions than when he arrived, but one realization stayed with him. The biggest health risk wasn't simply getting older. It was assuming that yesterday's medication plan would always be the right one for today. Getting older doesn't automatically make medications dangerous. In fact, many medications save lives every single day. The important point is that aging changes the way the body responds to medicines. That's why doctors often review medication lists more carefully in older adults. Sometimes a medicine that once offered more benefit than risk gradually shifts in the opposite direction. Sometimes the medication itself hasn't changed. Your body has. And that's an important difference. In today's video, we're going to explore 5 common medications that doctors often review carefully in adults over 60 because in certain situations, they may affect factors related to stroke risk or other serious health complications. This doesn't mean these medications are unsafe. It means you should ask better questions. By the end, you'll understand why some medications deserve a second look as we age, which warning signs you should never ignore, and why over-the-counter medicines can sometimes be just as important as prescription drugs. But before we reveal the first medication, there's one surprising fact you need to know. According to healthcare experts, many older adults take 5 or more medications every day. Each medication may be appropriate on its own, but when they're combined, the overall picture can become much more complex. And that's exactly why the first medication on our list surprises so many people. It's sitting in millions of medicine cabinets right now. Most people use it for nothing more than everyday aches and pains, yet it may quietly influence one of the biggest risk factors for stroke, your blood pressure. Coming up next, medication number 1. Medication number 1, understanding the silent risk of NSAIDs. Hello and welcome. I'm Dr. David Wilson. If you're new here, my mission is simple. I help adults over 60 better understand their health using evidence-informed medical information explained in clear, everyday language. Every week, we explore the latest research on healthy aging, stroke prevention, heart health, brain health, kidney health, nutrition, medications, and lifestyle habits that may help you stay active and independent. Whether you're looking to better understand your own health or care for someone you love, you're in the right place. Please subscribe and turn on notifications so you never miss a new episode. Now, let's get started. Before we reveal the first medication, let me ask you a simple question. When was the last time you reviewed every medication you take, not just the prescriptions, but also the over-the-counter medicines sitting in your cabinet? If you're like many people, the answer is probably, it's been a while. When a medication relieves pain or reduces swelling, it naturally becomes part of your routine. You trust it. You assume it will always be the right choice. But medicine isn't only about what you take. It's also about how long you've been taking it and how much your body has changed since then. The body you have today isn't the same body you had 20 years ago. Your kidneys may filter medications more slowly. Your liver may process medications differently. Even your blood vessels respond differently than they once did. A medication that worked perfectly at age 45 may deserve a second look at age 70. And that brings us to the first medication on today's list. Medication number 1, NSAIDs. You may not recognize the term NSAID, but you've almost certainly heard the names Ibuprofen and Naproxen. These are among the most commonly used pain relievers in the world. People take them for arthritis, back pain, or joint stiffness. For many older adults, these medications make it possible to stay active and maintain independence, and that's an incredibly important investment in your long-term health. So why are we talking about them today? The concern is that for those living with high blood pressure, kidney disease, or heart disease, frequent use may affect the cardiovascular system in ways that deserve attention. Imagine your circulatory system as the plumbing inside a home. When every pipe is open and working properly, water flows smoothly. Now imagine those pipes becoming just a little narrower. Water still reaches every faucet, but the pressure inside the pipes increases. Something similar can happen inside the body. NSAIDs reduce pain by blocking chemicals called prostaglandins. Those same chemicals also help maintain healthy blood flow to the kidneys. When prostaglandin activity is reduced, some people's kidneys retain more sodium and water. That extra fluid increases the amount of blood the heart has to pump. For certain individuals, that may contribute to higher blood pressure. And high blood pressure remains one of the strongest risk factors for stroke. Now, this doesn't happen to everyone. Many take NSAIDs safely under medical supervision. But your age and kidney health all influence the choice. Let's go back to Robert. A few years after retiring, arthritis began affecting his knees. He loved gardening, but bending down to pull weeds became painful. His doctor recommended an anti-inflammatory medication. It worked beautifully. Within weeks, Robert was back outside in his garden. He could walk farther, sleep better, and spend active afternoons with his grandchildren. Life felt normal again. Months passed, then years. One afternoon, Robert visited his physician for a routine checkup. The nurse looked at the monitor and then checked it again. His blood pressure was higher than it had been during previous visits. Nothing alarming, just different. His physician sat down and asked a question Robert never expected. "How often do you take your pain medication?" Robert thought for a moment. "Honestly, almost every day." That single answer changed the conversation. They reviewed his kidney function, reassessed his arthritis, and discussed physical therapy. The doctor didn't blame the medication, he looked at the whole picture. That's what good medicine is all about. The heartburn medicine hidden in millions of homes. Medication number 2, proton pump inhibitors. Here's something that surprises many people. If I asked you to name a medication that could possibly influence your long-term health beyond your stomach, heartburn medicine probably wouldn't even cross your mind. After all, acid reflux affects the digestive system. Stroke affects the brain. What could those two possibly have in common? As it turns out, more than most people realize. Let's meet another viewer like so many across America. Her name is Linda. Linda is 69 years old. She enjoys traveling, spends time with her grandchildren, and never leaves home without water. Several years ago, she began waking up almost every night with a burning pain in her chest. At first, she worried it was her heart. Fortunately, it wasn't her heart at all. It was severe acid reflux. She was prescribed a medication to reduce stomach acid, and within days, she felt dramatically better. The medication seemed almost miraculous, but months became years. Eventually, taking that little capsule each morning became as automatic as brushing her teeth. She simply assumed that if the medicine continued helping, she should continue taking it. That's exactly what millions of people do. These medicines are commonly called PPIs. You may recognize names like omeprazole, pantoprazole, or esomeprazole. Doctors prescribe them for good reasons, healing ulcers and reducing reflux. For many, they significantly improve quality of life. But for older adults, long-term use deserves periodic reassessment. The answer isn't because PPIs are dangerous, it's because your stomach does more than digest food. Stomach acid also helps release certain vitamins and minerals from the foods we eat, making them easier for the body to absorb. Think of stomach acid as the key that unlocks nutrients from your meals. Without enough acid over long periods, some people may absorb lower amounts of nutrients such as vitamin B12, magnesium, and calcium. If the key isn't working as effectively, some nutrients become harder to access. Let's talk about magnesium. It rarely makes headlines, yet your body depends on it every day. Magnesium helps muscles contract normally, supports nerve function, and plays an important role in maintaining a steady heartbeat. Low magnesium levels can contribute to muscle cramps or fatigue. When magnesium becomes too low, people may notice muscle cramps, weakness, or fatigue. Again, these problems are not common for everyone taking a PPI, but they're important enough that healthcare providers remain aware of them. Now let's look at vitamin B12. Vitamin B12 deficiency often develops gradually. Someone may begin forgetting little things, feeling unusually tired, or experiencing tingling in their hands or feet. Many older adults assume these changes are just part of getting older. Sometimes they are, but sometimes they aren't. At this point, you may be wondering, what does stomach acid have to do with stroke? It's a fair question. Researchers have studied whether long-term PPI use may influence cardiovascular health. While the evidence is mixed, medical experts recommend using them only when medically appropriate. The message isn't fear or panic, it's thoughtful, individualized care. Use the lowest effective dose when possible, and periodically review whether you still need them. That simple habit ensures your treatment still matches your health today. During Linda's annual checkup, her physician stopped at one medication. "Linda," he asked, "do you remember why you started taking this?" She realized she hadn't tried without it in years. That conversation led to a reassessment. It wasn't about stopping, it was about matching today's treatment to today's health. So far, we've talked about medications for pain and heartburn, but the next medication works directly on the brain itself. Doctors prescribe it for anxiety or sleep, but after age 60, the brain's response begins to change. Medication number 3 may be one of the most misunderstood prescriptions. Coming up next, medication number 3. The sleep medication that could be affecting more than your rest. Medication number 3, benzodiazepines. Have you ever noticed that sleep becomes more complicated as you get older? Maybe you wake up several times during the night. Maybe you find yourself staring at the ceiling at 3 o'clock in the morning. Or perhaps anxiety keeps your mind racing long after you've turned off the lights. If any of that sounds familiar, you're not alone. Millions of adults over 60 struggle with sleep. And when you're exhausted, a good night's rest can feel like a blessing. For many people, that's exactly where this next medication enters the story. Let's meet someone we'll call Mary. Mary is 72 years old. After her husband passed away, the nights became the hardest part of the day. She would lie awake for hours replaying memories and watching the clock slowly move toward morning. She was exhausted. Her physician prescribed a medication to ease her anxiety and improve her sleep. Within a few days, everything changed. For the first time in months, Mary slept through the night. She finally felt like herself again. But weeks turned into months, and then years. Eventually, taking that small tablet became just another part of her nightly routine. This group of medications includes familiar names such as lorazepam, alprazolam, diazepam, and clonazepam. Doctors prescribe them for several reasons: severe anxiety, panic attacks, or to help those struggling with insomnia. The concern isn't that these medications don't work, they are often effective. The concern is how our bodies respond to them as we grow older. Aging changes the way the body handles many substances, including medications. The liver and kidneys often process drugs more slowly. As a result, some medications remain in the body longer. Instead of wearing off overnight, their effects may continue well into the next morning, leading to morning grogginess or slower reaction times. For some older adults, this can lead to difficulty concentrating or feeling less steady while walking. These problems are common enough that healthcare providers pay close attention to them when treating older adults. Doctors are often less worried about the pill itself than about what happens after someone wakes up. Imagine it's 2 o'clock in the morning. You stand up quickly in a dark room. Your balance isn't what it used to be, and your reflexes are slower. Falls are one of the leading causes of serious injuries among older adults. A single fall can lead to broken bones, surgery, or months of rehabilitation. That's why medical organizations encourage regular reviews of sleep medications. But what does falling have to do with stroke? Medications influence many aspects of overall health. One important consideration involves sleep apnea, a condition where you stop breathing repeatedly while you sleep. Untreated sleep apnea has been linked to high blood pressure and stroke. Because certain sedative medications can relax the muscles involved in breathing, they may worsen sleep apnea in some individuals. Doctors consider the whole person before deciding. At her yearly checkup, Mary's physician asked, "Is this still the safest way to help you sleep?" Mary was surprised. She assumed the discussion was over because the medication worked. Instead, they talked about sleep habits and stress management. The goal wasn't to take away something that helped her. The goal was to make sure her treatment still matched her health today, not her health 5 years ago. Now, here are 4 questions worth asking during your next appointment. Do I still need this medication? Could it be contributing to balance problems? Is my current dose still appropriate? Are there other treatment options? That decision should always be made together with your healthcare provider. So far, we've explored medications for pain, heartburn, and sleep, but the next medication doesn't require a prescription. Millions take it during cold and flu season without thinking twice. Yet, for older adults, one common ingredient may place extra strain on the heart. Medication number 4 is one of the most overlooked. Don't miss what's coming next. Imagine opening your medicine cabinet tomorrow morning. Inside is a tiny white pill. It's smaller than your fingernail. It costs only a few cents. You've probably seen it thousands of times. Maybe you've taken it every morning for years. Maybe your spouse takes it. Maybe one of your parents swore by it. For decades, this little pill earned a reputation as one of medicine's greatest success stories. Doctors recommended it, neighbors talked about it, television commercials praised it. Millions believed one small pill each day could protect them. For many people, that advice saved lives. But then something happened that almost no one expected. Was daily aspirin helping everyone equally? The answer turned out to be far more complicated. Let's meet Richard. Richard is 71 years old. Every morning he swallowed a baby aspirin. He had done it for almost 15 years. No one reminded him anymore. He simply believed it was part of staying healthy. When friends asked why, his answer was always the same. My doctor told me years ago it helps prevent heart attacks. And for a long time, that advice reflected the best evidence. But medicine never stands still. Doctors continue learning. Research continues evolving. Aspirin works by making platelets, tiny blood cells that help form clots, less likely to stick together. Think of them as emergency repair crews. If you cut your finger, they rush to the area and help stop the bleeding. That's an essential job. But sometimes a clot forms where it shouldn't. If a clot blocks blood flow to the heart, it can cause a heart attack. If it blocks flow to the brain, it can cause an ischemic stroke. Because aspirin makes clot formation less likely, it has saved countless lives in people who already have cardiovascular disease. For those individuals, daily aspirin remains an important treatment. The benefits can be substantial. But Richard's situation was different. He had never experienced any of those conditions. He was taking aspirin just in case. And that's where modern research changed the conversation. Over the past several years, researchers completed large clinical trials involving thousands of older adults to answer a simple question. Should healthy adults without a history of cardiovascular disease take aspirin every day to prevent their first heart attack or stroke? The results surprised many people. For some, the benefit was smaller than believed. At the same time, one risk became harder to ignore: bleeding. Every medication has benefits. Every medication has risks. The goal of good medicine is finding the right balance. Because aspirin reduces clotting, it can increase bleeding, sometimes in the stomach or related to ulcers, in rare cases inside the brain. The chance of these complications increases with age and taking certain other medications such as blood thinners or some pain relievers. That's why today's recommendations are much more personalized than they were 20 years ago. Doctors now ask a different question. Does this particular person have more to gain than to lose? That single change in thinking has transformed how aspirin is used in preventive care. During Richard's yearly physical, his new physician reviewed every medication. When they reached the aspirin, the doctor didn't immediately stop it. Instead, he asked, "Richard, what was the reason you started this medication?" Richard paused. "I honestly don't remember," he admitted. The conversation that followed wasn't about fear, it was about understanding Richard's current health, his blood pressure, his cholesterol, his history. Only after looking at the complete picture did they decide whether aspirin was still the right choice. That's exactly how decisions should be made. Not based on a headline, not because a friend recommended it, not because something worked 20 years ago, but because it fits your health today. If today's video has shown us anything, it's this. Medications don't suddenly become dangerous when you turn 60. Your body simply becomes different. The kidneys may filter medicines more slowly. The liver may process them differently. Blood vessels become less flexible. The brain becomes more sensitive to certain drugs. Medications that once worked perfectly may deserve another review. Your healthcare deserves to evolve along with you. We've now explored all 5 medications, but there's one hidden danger we haven't talked about yet, and surprisingly, it isn't any single pill. It's what happens when several medications are taken together. Doctors have a name for it. It's called polypharmacy. It may be the most overlooked risk. In our final chapter, you'll learn why combinations matter, a simple checklist to review them safely, and one habit to avoid problems before they happen. Don't miss the conclusion. It may be the most valuable part of this entire documentary. Stay tuned for the final chapter. Picture this. It's the middle of winter. You wake up with a pounding headache, a stuffy nose, and so much congestion that breathing through your nose feels almost impossible. You don't call your doctor. You don't think twice. You simply stop by the pharmacy and pick up a cold medicine. It seems harmless. After all, it's sold right there on the shelf. No prescription, no special warning from the cashier, just another product that millions of people buy every year. But here's the surprising part. Sometimes the medications we worry about the least are the ones we understand the least. Let's meet John. John is 74 years old. He's active, enjoys woodworking in his garage, and rarely gets sick. But one January weekend, he came down with a nasty cold. His nose was completely blocked. He couldn't sleep. So, like many people, he bought an over-the-counter cold medicine that promised fast relief. Within an hour, his congestion improved. He could finally breathe. Problem solved, or so he thought. The next morning, John checked his blood pressure. It was noticeably higher than normal. At first, he blamed the cold, but during a follow-up visit, his doctor asked an unexpected question. "Did you happen to take a decongestant?" John nodded. He had no idea the medicine he bought without a prescription could temporarily affect his blood pressure. Many cold and sinus medications contain ingredients such as pseudoephedrine and phenylephrine. These medications are called decongestants. Their job is simple. When you have a cold, the blood vessels inside your nose swell. That's what creates the feeling of being plugged up. Decongestants narrow those swollen blood vessels, allowing more air to pass through. That's why your nose feels clearer. For many people, they work exactly as intended. The challenge is that these medications don't act only inside the nose. Your blood vessels can't tell the difference. Imagine you're trying to reduce traffic on one busy street in your city. Instead of closing only that street, you accidentally narrow roads throughout the entire city. Traffic patterns begin changing everywhere. Something similar can happen inside the body. While decongestants help shrink blood vessels in the nose, they can also cause blood vessels in other parts of the body to narrow. When blood vessels become narrower, the heart may have to pump against greater resistance. For some people, this can temporarily increase blood pressure or speed up the heart rate. If you're young and healthy, changes are small. But after age 60, many are already managing conditions. In those situations, even temporary increases in blood pressure may deserve extra attention. Here's something doctors think about that many patients never do. It's called the medication puzzle. Imagine laying one puzzle piece on a table. It doesn't reveal much. Add another, then another. Eventually, the entire picture appears. Your medications work the same way. One prescription for blood pressure, another for arthritis, something for diabetes, a cholesterol medication, perhaps a daily aspirin. Then one over-the-counter cold medicine gets added. Each medication may be reasonable by itself, but together they create a much more complex picture. That's why pharmacists and physicians always want to know everything you're taking, not just prescriptions, vitamins, herbal supplements, sleep aids, cold medicines. Even products you only use once in a while. Sometimes the most important medication in your bag is the one you forgot to mention. Read more than the brand name. One mistake many people make is choosing a product based only on the large print on the front. Cold relief, sinus pressure, maximum strength. Those words tell you what the product promises to do, but they don't tell you what's actually inside it. Turn the box over. Read the active ingredients. You may discover that two different products contain the exact same decongestant, or that one product combines 4 or 5 medications into a single capsule. Understanding what you're taking is one of the simplest ways to reduce unnecessary medication risks. Questions worth asking. Before taking an over-the-counter cold medicine, ask yourself, do I have high blood pressure? Have I ever had a stroke or heart attack? Do I have kidney disease or heart disease? Have I asked my pharmacist whether this product is appropriate for me? Pharmacists are medication experts. A short conversation can prevent problems. One more surprise. We've now talked about pain relievers, heartburn medications, sleep medicines, and cold remedies. Every one of them helps millions of people. But the final medication on today's list has one of the most fascinating stories in modern healthcare. For decades, doctors encouraged millions to take it every day. Many believed it was the simplest way to prevent heart attacks. Then something unexpected happened. As larger studies were completed, medical recommendations began to change. The same medication once recommended for everyone suddenly became something doctors prescribed much more selectively. If you've been taking a baby aspirin every morning for years, the next chapter may be the most important one. Coming up next, medication. Number 5.